The Duke University School of Nursing does more than educate the next generation of nursing leaders. It also uses scientific research to contribute solutions and improve care for some of the world's most complex healthcare problems. One of those problems is sickle cell disease, or SCD. SCD is a group of hereditary blood disorders related to abnormally shaped red blood cells. Sickle cell disease may lead to various acute and chronic complications, several of which have a high mortality rate. Millions around the world are affected by this debilitating condition, which is painful, complicated to treat, and can ultimately shorten life expectancy. Dr. Paula Tanabe, an associate professor at the school, has dedicated much of her work to improving our understanding and treatment of SCD.
My background was an emergency department nurse for over 25 years. And my research when I started with a PhD was in improving pain management in the ER. And so what I saw over the years is we started to take care of pain much better, except for patients with sickle cell. And as I learned more about the disease, then I actually got more research training and had the opportunity to sit in sickle cell clinics across the country. And so when I learned more about it, the more I learned that this is work I had to do and that it's so complex.
Dr. Tanabe's past research has made numerous contributions to emergency department assessment and care of SCD. Recently, Dr. Tanabe, along with her co-investigators and a consortium of healthcare providers, were awarded $4.6 million for their grant, Improving SCD Care Using Web-Based Guidelines, Nurse Care Managers, and Peer Mentors in Primary Care and Emergency Departments in Central North Carolina. The grant is funded by the National Heart, Lung, and Blood Institute, as well as the NIH, and will be for a 6-year period. Dr. Tanabe says it is all about improving the quality of life for SCD patients.
And the grant is really about improving the lives of persons with sickle cell disease throughout the nation. And specific to us in North Carolina, we are working with CCNC for 1/3 of the state's population. So we're really working with all the patients ages 15 to 45 throughout Central North Carolina. The purpose of the grant is to really improve the lives of individuals aged 15 to 45 with sickle cell disease, because the life expectancy is still abysmally poor, where persons with sickle cell disease, the average lifespan is 38 or 42. And in the past, it was children didn't even survive to adulthood. And so now with some great research in pediatrics, children are surviving, and now we have adults, but they still die in their 30s and their 40s. So in this grant, there's actually 3 main phases of this grant. And the first grant is to do a really comprehensive assessment in the community of what are the barriers to getting care, because we know how bad the outcomes are, and what the NIH wants to do is to really improve those outcomes. So we have to understand, why are these outcomes so bad? So each center that's funded by the NIH is charged with doing a very comprehensive needs assessment. So we're going to be doing focus groups and interviews and eventually large surveys with a variety of stakeholders. My background is an emergency department nurse, and so there's a large piece as well that we're going to be interviewing emergency department nurses and physicians, and they will be doing that across the country as well, because that historically is where care is very, very challenging to get and to deliver as well. So we'll be really wanting to target, why is it so difficult? What are really all the barriers from all angles to getting care if you're living with sickle cell?
Dr. Tanabe says the grant will use that wide variety of research methods to improve care for SCD patients, both inside the emergency department and also for outpatient care.
What other resources do we need to give to really change the way we deliver healthcare? And that ultimately will hopefully improve the quality of life that patients have, which is why we're getting quality of life measures about pain and fatigue and sleep, things that individuals living with sickle cell have told us are really important to them.
Ultimately, Dr. Tanabe's research will improve our understanding of care for SCD, and by using data-driven solutions, will change how we treat and care for these patients. If you'd like to learn more about Dr. Tanabe's work or her grant, please visit our website at nursing.duke.edu.